So I'm Barbara Tytka. I'm a registered nurse, and today we want to thank Marlene and Sherry for inviting everybody here to get a little information about our practice, kind of what we do, incorporating both conventional and holistic medicine, and some of the treatments that we do, especially with the IV therapies. So a little bit about like our mission and kind of where we got to this position. You know, everybody has choices in healthcare and doctors, and really what we wanted to do was create an atmosphere where there's a close relationship between the provider and the patients, where we are listening to everything, we're taking time, we're looking at the whole picture and really offering each and every patient you know, every facet that's available, both conventional medicine and holistic medicine. We use a collaboration with every member of their staff, so whether you see Marlene or you see Sherry, we all collaborate on pretty much each and every case. So whether it involves me and, you know, IV treatments or any of the other treatments that I do, even Liz, the office manager, who's really kind of the arms and legs of the practice, she's in on it too, because she's following up on test results and lab work and things like that. So it really takes a collaboration. When you get one of us, you get everybody. And it's really using everything that we have to address your physical, your emotional, your spiritual, mental, all of the needs to bring optimum health to each and every one of you. So the focus for tonight, because I tend to go off on tangents and everything, so I try to keep really focused on what we're doing. I want to introduce you to the IV therapies that we do. We're kind of break it down, and when we get into it, we're going to kind of start and break down what happens when you get to the state when you're middle-aged and you start to not feel good. Like, where did that start? So we're going to kind of we're going to educate you on all of the treatments. All of the pieces of information that I have, it's kind of a compilation of different articles that I've collected over the years, really that were written by doctors, medical researchers, kind of pioneers of the alternative medical community. So they're just very evidence-based pieces of material, nothing I wrote myself, but I just thought that it's really good information to put out. So again, with everybody being here, this is the first of our series, and if you like it, we're probably going to repeat it really quickly just because there's a lot of information. So from the start of our practice, we see patients anywhere from late teens all the way up into the 90s. So it's a pretty wide range of population that we're trying to reach. And so we're like, how do you reach that wide of a range? And we really have found that word of mouth has been like our biggest resource. So we appreciate everybody coming here to listen. Take the information, take it home, read it, digest it. If you see something that you can pass on to friends and family, anything like that, just follow us on Facebook, check our Instagram, check our website, because we're going to continue these series. And like I said, if we repeat this, you might want to come back and re-listen. Maybe you missed something, or maybe you just want to hear something again. And then just look for other informational seminars that we're going to give on essential oils, medical cannabis perhaps, maybe incorporating, how do we incorporate conventional and alternative treatments, and you know, really just to put it out there in the public and the education with it. So a little bit about myself. Again, I'm Barbara Tytka. I have been doing these IV treatments for more than 20 years, which doesn't seem possible at all. It's like your kids that grow up and you wonder where time goes. But just a little bit about my background. I've been a registered nurse since 1995, and I started my nursing career at Sisters Hospital, a very busy medical surgical unit. While I was there, I became a nurse preceptor, so I was training new registered nurses to the medical surgical unit. I was trained as a charge nurse, so I would step into that role as needed, and I also did quality assurance and improvement for our unit as well as the hospital. So I was involved in writing protocols that were then kind of put hospital-wide. So over the years that I was there, I was inching my way up into my nursing career. And it was in 1998 that my dad actually came to me and said, I found the treatment for my heart disease. He's like, I'm going to get chelation therapy. And I just thought, Dad, what are you doing? You know, the only time I'd ever heard of chelation was when I did my pediatric rotation. They said chelation therapy was what they used to treat children for lead poisoning. So that was my only exposure to it. But I thought, you know, okay, whatever. So I used to go down to my dad's appointments, and at the time he was seeing Dr. Barnes down in Fredonia. So I just kind of went down there to see what he was doing. And actually, the book 40 Something Forever was the very first book that Dr. Barnes gave me the very first time I ever met him. So that book is kind of still around, still on the shelves. You can still get it because it really lays out kind of the foundation of chelation therapy, specifically where that came from and why patients saw it as an alternative for bypass surgery. My dad was getting treatments for a couple months, and before I knew it, I started working for Dr. Barnes, and about 3 months after that, I left my position at Sisters and started doing IVs from that point on. So that was back in January of 1999. So the IV therapies and what we have to offer. When I discuss the IV therapies, because there's so many things that can be added, there's kind of, you don't really know what is it I need. Do I need nutrition? Do I need vitamin C? But they're kind of the same. Do I need chelation? So I like to break it down into 3 categories to kind of make it simple for everybody to understand. And that is your nutritional IVs, your oxidative IVs, and your detox IVs, which like chelation type IVs. But just keep in mind as we talk about them, these IVs can kind of cross those boundaries. Nutritional IVs can behave as a detox IV. A vitamin C IV can behave as an oxidative IV. But I kind of make it simple like that to make it easy for you to kind of categorize what each of the treatments do. And then as we go through, we're going to really break down each one of those. So the nutritional IV, and if you've ever seen the pamphlet that we put out, basically nutritional IV is exactly what it sounds like. It's a solution of vitamins and minerals that's delivered into the bloodstream, and it goes directly in and reaches the cellular level. It raises serum concentrations in the bloodstream that aren't attainable just by oral supplementation. So really kind of what does that mean and why do I need to get it, basically? Because when you say to your doctor or you say to a family member, oh, I'm going to go for an IV vitamin drip, and the first thing people will say was, what do you need that for? Usually the first thing they're going to say is, if you eat right and have a healthy lifestyle, you don't need IV therapy. Number 2, if you get that, you're just going to pee it out anyway. And number 3, there's no scientific data to back up the benefits of that. So going back to the first thing, if you eat right and have a healthy lifestyle, you don't need it. But think about it, even healthy people, sometimes you get sick. You end up getting a cold, you get a sinus infection, you get a GI ailment. There's a huge population of exercisers, runners, athletes that getting nutritional IVs, especially with amino acids, it helps with muscle recovery. It helps with strenuous workouts. Everybody kind of knows when you go and you hit the gym, the next day you can't sit down, your muscles hurt, and it sometimes can take 3 to 4 days to recover from that. So getting IVs help that muscle recovery. And then also, again, if you're just feeling sick, if you're relatively healthy, but you tend to come down with something, that's good. It helps to boost the immune system. It kind of helps to bring you back. The second thing, that you're just going to pee it out anyway. This one I hate, because as soon as somebody gets their IV, they get it out, they go and they use the restroom, and they come out and they say, it just smelled like vitamins and minerals. And right away, the first thing they think is, I just paid a lot of money for an IV that I just got rid of. And that's not true. That's not the way it works. And we're going to explain a little bit more when we're talking about the molecular activity that's happening when you're getting an IV. But basically, you're using these vitamins and minerals, you're using these molecules, your body is breaking them down, and your body's going to get rid of the byproducts, get rid of the metabolites. It doesn't need to keep that, and that is what you're seeing. As well as, it's in a bag of sterile water, which is a pretty fair amount of intravenous fluid, and your body is obviously going to get rid of the fluid. One example that I like to use with patients is, over my course of nursing, you hang a lot of IVs with antibiotics. And you think, well, I just got a big bag with antibiotics, but I just went to the bathroom. Do you think you eliminated all the antibiotics? Of course not. The antibiotics go in, they do their job, and they get rid of the bacteria. The same is true of the vitamins and minerals. They go in, they have a job to do, and when it's time to get rid of them, you will. And last thing, there's no scientific data to back up the benefit, and that absolutely is not true. There's thousands of articles that have been written and published on the benefits of, you know, vitamins and minerals in general, but as well as IV therapies, nutritional therapies, high dose vitamin C, chelation, and even the oxidative type IVs. Lots of information, and I always say that for every, you know, one article that is, you know, a wonderful article that really supports the benefits, you're going to find 3 or 4 that dispute it, just because, you know, there's people that don't really want this to, you know, to be the course of treatment for some people. I don't like to be cynical about things, but it's hard to deny that pharmaceutical companies have, you know, a financial agenda. And their financial agenda is to keep people sick. So there's no better way to sell more medications than to keep people sick and keep prescribing and keep, you know, coming up with new medications. So the last thing they want is for patients to actually get something that reverses disease. And when you think of medications, it's hard to come up with medications aside from antibiotics and certain things that actually cure a disease. Like blood pressure medicine doesn't cure blood pressure. Diabetes medication doesn't cure diabetes. And, you know, if you say cancer, you know, they're not curing cancer with it. So they don't really want anything that sets out to cure or reverse of chronic disease. So we're going to talk about the breakdown. We're going to start with the nutritional IVs, because I think when you gain understanding of why somebody gets into the state of malabsorption, it's going to really then, you're going to understand what the other treatments do as well. So again, the nutritional IV, it's the vitamins and minerals that go into the bloodstream. And why is that important? Because it's bypassing the GI tract. So when you whether it's a healthy diet, whether you decide you need to take oral supplements, everything has to then go through the GI tract. And the first part of your GI tract is obviously your mouth. You have enzymes in your mouth that start the process of breaking down whatever it is. It has to go down the esophagus, empty into the stomach, where it kind of hangs out there for a couple hours. You need digestive enzymes, you need hydrochloric acid in your stomach to help break that down. And that takes a couple hours usually before it dumps into the small intestine, where it is further broken down into fine little pieces. As it continues on, it breaks down, and it has to actually pass through the intestinal lining, pass into the bloodstream. So these now are molecular structures that then have to pass through a cellular membrane to go inside the cell to create that metabolic process. So if you think from start to end, that's a lot of gates that has to pass through. And if you have a break or a block in any one of those areas, it's going to result in some sort of absorption problem. So whether it's not breaking down, or you know, you have maybe cell membranes that don't allow the passage of these molecules, it's going to interrupt the absorption. So that is the one main reason why you know, there's the benefit to getting IV therapy. And I say, you know, best case scenario, you're a healthy person, and like we said, as it's passing through, it has to pass through all those gates. Now think of somebody that, for an example, we see people that maybe as a child, they were on antibiotics a lot. You know, back in the 70s, 80s, 90s, kids were on antibiotics like it was penny candy. And I've talked to patients that as kids, they were on antibiotics maybe 3 or 4 times a year. And you didn't really think like, well, what's that really going to do 20 years down the road or whatever? What is that doing to their gut and their flora? You take that same child and maybe into, you know, young adulthood, if it's a female, maybe they're on oral contraceptives, and that could be maybe 15, 20 years of their life. If they were unhealthy, or perhaps along the way they developed allergies and they might have been on a steroid, that's another thing that can interrupt and have long-term effects on the gut. So when you look at the things that can happen throughout your life that can interrupt absorption over a long period of time till somebody gets into their mid-40s or whatever, then you start to realize, why am I fatigued? Why do I ache all over? Why do I feel like I just have no energy? And that's when you know, when patients come here and they start with the consultation process, you really look at the very beginning, and we kind of work through and see what happened along the way that could have caused malabsorption. As well as different medications. I mean, we talked about like the enzymes that are needed to help break down. So it makes me cringe when I have friends or family members that, you know, they eat something, and it could be a nightly thing that happens, or several nights, or maybe on the weekends, that you wake up, you got heartburn, you got indigestion, you got reflux, and what's the first thing you do? You take the Tums, you take antacid, you take whatever it is. And what do you think that's doing? That's like right there in the stomach. Now you're diminishing the acid in your stomach, so now your food is not breaking down. So now it's not breaking down in the stomach, but what happens, your stomach pushes it into the small intestine. So now you have not completely digested food where it should be into the small intestine. I think of it, and I was telling Sherry earlier, like I think of it as your kids or your husband. Somebody eats late at night, they throw the dirty dishes in the sink, they run water on them, you get up the next morning and it's like disgusting. I think of that as what partially digested food in your small intestine is looking like. What happens is it sits there and it starts to ferment. And what happens when you get fermentation? You get gas, you get bloating, you get indigestion. I mean, if anybody has GI symptoms like that, it kind of sounds familiar. So what do? You go to your doctor, you talk like, these are my symptoms, they put you on a medication. So it's just a cascade effect that happens. And really, if we can just correct the problem from the very start, reestablish the flora in your gut, and it sometimes takes the IV therapies because it takes time. It takes time to reestablish the flora, and then it really sets you on the road to much, much better health. Any questions up until now? Okay. So I mentioned gut health because, you know, it's been the buzzword in probably the last 10 years. Everybody's talking probiotics. You know, 20 years ago when I started, if somebody said, you know, I'm taking an antibiotic, and back then the doctor would say, well, let's put you on a probiotic. You thought, what is a probiotic? And then it seemed like the yogurts were the first thing that started to come out with the probiotics. And now pharmaceutical companies are making probiotics. And so everybody has really you know, they've grasped that thought that most of your immune system is happening in your gut. So when you have had an unhealthy gut, or you have been somebody on a lot of antibiotics that has interrupted that, after months and months and years of having that, you begin to develop what is a leaky gut syndrome, if you've ever heard of that. And I actually have some information there. It's pretty lengthy, so we're not going to go completely into leaky gut, but it's a syndrome that just snowballs into you know, the years where you're starting then to develop chronic fatigue, adrenal fatigue, and those types of things. And you think, but I eat well, but I do this, and you know, you're fatigued, you take more supplements, and by the time you come in, you're on maybe 10 different supplements, and it's not helping because you're not absorbing it. They've kind of, statistics say that even taking oral supplements, you're maybe absorbing anywhere from 5 to 20% of them, which is better than not absorbing any at all, but it's not great. But when you're getting intravenous therapies, you're absorbing 100% of those nutrients. And then, of course, you know, there's a whole list of things that these types of malabsorptions can lead to as far as chronic disease. You're talking, like I said, chronic fatigue, adrenal fatigue, autoimmune disease, diabetes, heart cancer, and so much more. Just to mention, like, a little bit of the molecular function, because you think, okay, so now I understand that whatever it is, whether it's IV or whether it's going and absorbing through the GI tract, what's happening, like, why are these vitamins and minerals, what are they doing, why are they important? These are molecular structures, and what they do is they start to build different metabolic processes in your body. So your body is, it's a mechanical machine, it's a chemical machine, an electrical machine, and you don't realize it, but all these things that you think about, potassium, calcium, like your electrolytes. These are all things that make your body go. They're chemical messengers. So when you talk about the things that are in the IVs, whether they're, your B vitamins or your trace minerals, they're the building blocks of these chemical messengers. And what do I mean by that? I'm talking the enzymes, the coenzymes, factors, cofactors, hormones. These are all things that make your body go. So when you're lacking a certain nutrient, it's almost like I think of it as like a big box of Tinker toys that you just dump on the ground and you build stuff with. And your body has to build these molecules. But what happens when you don't have the little green knob that you need? So it's almost like molecules fit together like little keys and locks. And when you're missing one of those links, what does your body do? It either tries to find something that fits in there, it kind of works. I like to describe it as it's almost like putting bad gasoline in your car. It kind of gets you from here to work, but it sputters along. It might run that way for a while, maybe even a few years, but eventually it just stops running. And just imagine, like, if you've dealt with chronic fatigue, that's kind of how you feel. You feel like you're going. And after 3 years, after 5 years, it could be 5 to 10 years down the road, you're like, I just can't go anymore. And it's because you've had years of lacking a certain molecule, a certain mineral. Maybe the hormone function is diminishing, enzyme function is diminishing. And these are things that just kind of compound until it develops into a chronic disease. So if you understand that kind of thing, like breaking this stuff down, you kind of get a better understanding then what is happening at the cellular level with all of the IVs, with nutrition, with chelation, and so forth. So what is basically in our nutritional IVs? B vitamins, so you have B12, and here at Advanced Integrative Care, we use methylated B vitamins. It has been tested for decades. It's something rather, I would say, new that we're testing for genetic variations that you can't methylate certain vitamins, and it is happening to more and more of the population. So just across the board, we use methylated B vitamins and methylfolate in all of our IVs. Along with that, there's B complex, so you have your thiamine, your niacin, riboflavin, you have pyridoxine, dexpanthenol, which we add extra of that. You have all of your trace minerals, well, not all of them, but trace minerals such as selenium, zinc, chromium, manganese, electrolytes like magnesium, potassium. So it's really like a really good multivitamin. Along with that, we can add amino acids to that IV. So if that's something that you are lacking, something that you just need just a boost with, we can certainly add those to it. And then vitamin C, of course, is kind of like the powerhouse of vitamins. So with all of these vitamins, and I want to say too, it's not like when we describe it as the serum concentrations of these vitamins are increased when you're getting them IV. It's not like we're giving 10 times the amount of B12 in an IV. You're getting a normal dose of B12. The difference is you're absorbing 100% of that, where if you take an oral vitamin and mineral, you're just going to absorb a fraction of that. So what to expect kind of when you get an IV. Most of the time, I would say patients feel really great. They feel energized. There are some cases where this flood of vitamins going in, you have a lot of good stuff coming in. You're going to have this metabolic exchange and reaction. Well, your body has to detox that out. And so what your body trying to do is trying to get rid of the byproducts, get rid of the metabolites. And these vitamins and minerals, they don't go in and just have one job to do. So, B12 or trace minerals, they don't go in and do one thing and then it's done. It goes in, it performs a function, it might break it, and these are instantaneous. It goes in, it stimulates a hormone, and it does that, and now it's going on to the next thing. So these things break apart, they form another molecule, and they do something and break apart. And it's almost like a tree that finally, until the very end, you get down to where it's just metabolites, it's just the byproducts of chemical reactions, and your body gets rid of it. So if you're somebody that tends to detox, one of the biggest ways is because everything's being broken down through the liver, dumped in, and then your kidneys are eliminating it from your body. Drinking a lot of water is super, super important because it's going through the kidneys. And the more water you drink, the less likely you are going to detox from any of the IVs. But there are certain conditions that patients tend to detox a little more. So with that, we're just very careful with how we're giving them, how often we're giving them, how quickly somebody is getting them, and you just kind of monitor them. Any of the detoxes, they're not, I would probably say it might be uncomfortable. You might get fatigued. Some people might get a little, I would even say flu-like, but not even that severe. But mostly it's due more to dehydration than you're having any kind of reaction. You're not going to have a reaction to it. I think we talked a little bit about the IVs and healthy people getting them for weight loss. So there's a pamphlet out there because supporting the body with good vitamins and minerals as well as amino acids. And here we offer not only the IV amino acids, but also injections that are intramuscular injections. They're called GAC and MIC, which are just two different combinations of amino acids that just support fat metabolism, support the mobilization of fatty patches, and they just support weight loss. They help recovery again with workouts and those kinds of things. So I just want to touch upon that, and you can take that home and look at that too. So I mentioned at one of the last ingredients of the nutritionals is vitamin C, and I called vitamin C kind of the powerhouse vitamin. Because vitamin C is one of those things that kind of can cross the line. All of the nutritional IVs have vitamin C, and this is the one thing that you can get 10 times the amount or more of vitamin C in the IV. So that is one thing that you could not take that much orally. You start to maybe get up to 4 or 5 grams of vitamin C orally, and you might start to get GI symptoms that can tend to cause gas, cause diarrhea, and that's because you're going through the GI tract. When you're getting it intravenously, you are getting anywhere from as little as 1-2 grams. We can put in as little as you need. Most of the time we're giving about 20 grams. So if you are normally taking about 2 grams, you're getting 10 times the amount that you can take orally. And we can go all the way up to 50, 60, 70. I've given as much as 100 grams of vitamin C in an IV. And the thing with vitamin C, usually when you read the package or you're looking, vitamin C is one of the best antioxidants that you can take, and that's what you typically hear it labeled as, antioxidant. But vitamin C has the ability to be an antioxidant, but in high doses, especially IV, because you have to reach a certain concentration, it can have a pro-oxidant effect. And what that means is oxidation is part of your body's own immune system. It creates an H2O2 molecule, a hydrogen peroxide molecule that actually can inhibit the growth of bacteria, viruses, yeast, parasites. So when you get vitamin C in a high dose, you're going to have a pro-oxidant effect. And we're going to talk a little bit more about the antioxidant-oxidant ratios. But just know, like the vitamin C, when you're getting it in a nutritional IV, generally you're getting about 20 grams. So at that dose, your vitamin C is kind of behaving more as an antioxidant. 20 grams is kind of about the teeter-totter. Once you start to go above 20 grams, your vitamin C, it's going to start to have that oxidative effect. When it's with a nutritional IV, you're having a lot of other antioxidants along with that, and it's going to kind of keep vitamin C acting like an antioxidant. It is when we give vitamin C by itself, which is one of the IVs that we offer, that in the high dose that you are getting that antimicrobial, antiviral, creating an environment where unhealthy cells can't survive. Here at the office, we don't, in pretty much alternative medicine, you don't say we cure anything. We don't cure cancer. We don't, what we are doing is treating the body to create an environment where those things can't survive in that kind of environment. So what kind of environment is vitamin C giving? Because we have found that chronic disease, whether it's cancer, whether it's diabetes, Lyme disease, they like to live and flourish in a more acidic environment. So the more oxidative type environment you can create that is raising the pH, raising the the alkalinity of that environment, and it's inhibiting the production or inhibiting the continued, process of degenerative disease. So really, that's really the goal, is to try to get your body to be more alkaline. And we do that a lot of different ways. There's different juices that we take, there's different things that, because we know that having a more alkaline environment is better for your health. So when you're doing the high dose vitamin C, that's what you're doing, and it's that kind of alkaline environment that is reversing your condition. So what is it good for? Vitamin C is probably the first thing I reach for if I'm feeling that I'm getting a scratchy throat, if I'm getting a sinus infection, a chest cold, anything like that. The vitamin C, it's going to knock it right out. And usually it just takes about 1 or 2, but it perks you up and it gets you back on your feet. Vitamin C, there's so much written, so many articles, so much research done. One of the resources that I use, and I don't know if you want to write this down, it's Reardon Research Institute. They put out just papers and papers, gobs of information on their studies on vitamin C. You're going to see vitamin C studies out of Canada, Mexico, Europe. They're all using vitamin C for treating viral infections, treating cancer, treating heart disease, conditions of the nervous system. They're using it for Alzheimer's, Parkinson's, not to mention general well-being. It helps for anti-aging, it helps with collagen formation, and just health in general. So it's kind of, like I said, it's one of the powerhouses. I don't know if you want to get into how we treat cancer, if that, how we use vitamin C. Vitamin C is used, like I said, a lot in combination with chemotherapies in Canada, in Mexico, and in Europe. And because in high doses it's giving that oxidative effect, it can actually work synergistically with chemotherapy. It actually helps chemotherapy work better. And I have said for years and years and years, patients who come in who are getting chemotherapy or radiation, they look better than any cancer patient that I've seen. They just do better. And I don't know if you want to talk a little more about cancer, if that you do want to talk. Okay.
Absolutely.
So all of the IVs, when somebody comes to us with cancer, never ever in my career have I ever said, you shouldn't get chemo, you shouldn't get radiation, you should only do this. That will never come out of my mouth. What I can stress is when patients are going through treatment, nutritional IVs, vitamin C IVs, other types of detoxing methods, whether it's far-infrared saunas or enemas like coffee enemas or hydrocolon therapy, anything that helps the body detox, helps the liver detox, is going to help that cancer patient. I've been seeing this for 20 years, patients getting it. So when somebody comes to us with a cancer diagnosis, after the initial workup, because we're going to do a lot of blood work, we're going to check for certain enzymes to see if they can tolerate high doses of vitamin C. We're going to put you on a regimen of nutritional IVs and the high dose vitamin C. The thing about vitamin C and being an oxidant, we were going to get into a little bit of antioxidant effects, because most of the time patients are on the shelf, they're buying all these things because they say antioxidants are the best thing, you need lots of antioxidants. And kind of what happens is your body likes to be in homeostasis, which is kind of like even. And what happens if you're taking way too many antioxidants, you're throwing your body out. Your body needs some type of oxidative process. That's why we breathe oxygen. Most of the time you're hearing like, what about free radicals? I hear that oxidation causes free radicals and that's dangerous for your body. It really is, but your body does create oxidative processes that are essential to life. And what we really call that is cellular respiration. You breathe oxygen, your body uses that in combination with nutrients to create energy. So your body needs some of those positive oxidative effects. So when you're getting vitamin C and it's creating that oxidative process, which is really hydrogen peroxide that's being created from the vitamin C. Right away, your cells want to secrete antioxidant to balance it out. Every cell in your body secretes, nearly every cell in your body secretes catalase, which is an enzyme that is protective against oxidative stress. Healthy cells secrete it as well as cancer cells. However, cancer cells don't have the ability to create as much as a healthy cell. So what the theory behind doing the vitamin C is to give the body, to give the patient enough vitamin C where it kills the cancers, well, I don't want to say kills the cancer, where it creates a process that the cell can't survive, the cancer cell can't survive, but not enough where it's damaging healthy cells. So cancer cells secrete catalase. So what happens is you give this I use it almost like a parameter. Like, here's the cancer cells, here's your healthy cells. So if you can get the vitamin C level up where it's toxic, and they actually in the literature they will say cytotoxic to cancer cells, but it's somewhere in this range where it's not toxic to healthy cells. That's kind of where you want to be. And so when we're giving vitamin C's, when we're going up in the doses, we're really pushing your body to your body's limit. Like, how much vitamin C can we give you before you start to feel the effects, like it's kind of making you feel yucky, that it's I don't want to say damaging healthy cells, but your healthy cells are stressing under oxidative stress. Years ago, we used to be able to test somebody's blood. As soon as they would have a vitamin C, we'd take it out, we'd draw a blood sample, you'd have to run it to the lab, spin it down, freeze it, and send it off to a lab that they could check the serum concentration of vitamin C. From that clinical data, they realized exactly what that level should be to where you had that cytotoxic effect. And they discovered that it was around 400 deciliters. And then what happens, New York State says, nope, you can't do that anymore. So it was during those years of experience of doing that, understanding how patients feel when they're just at the brink, when they're reaching that therapeutic level, but they're just to the brink, that I started to realize that they're symptomatic. They're just barely symptomatic. Because once we were no longer able to do that test in New York State, we had to go then by patients' feelings, how they're feeling. And that is just part of the experience that I've had, that I can just tell when somebody has gone over the edge. If they leave here and they said, you know what, I didn't feel great, I was cold, I was shaky, I just didn't feel good for about 2 hours after the IV, then we know, okay, you have probably more than reached the serum concentration that you need to be. We're gonna back off a little bit, and then you kind of sustain that, and if they need to bump up, we might bump up slowly, but we kind of can gauge where they are, where they're reaching that serum concentration level. Do you have any questions about that?
We have 100 questions.
Okay.
Well, usually most people, you keep at that safe level for them, like that they're not symptomatic.
Everybody
right?
has
Their own.
that level, and usually, again, just by clinical studies, by data, that oxidative process can happen anywhere from, say, on average, 40 to 70 grams. So for somebody that's tiny, and it might be 40 grams. If we go up to 45 or 50, they might feel like, you know what, I didn't feel great, so we're gonna back it off. Like I said, I have had patients that have had 100 grams. In fact, I have given 100 grams 5 days a week for a year to somebody, and they tolerated that, and that was their tolerance level. So really, it's based on patient's tolerance.
So that did, just because of what you said, so in conjunction with a chemotherapy treatment, would it be something that you normally do 5 days a week, or is it,
It really, I would say, that was pretty aggressive, I would say,
Okay.
for that particular person. I would say being on the aggressive side would be twice a week.
Okay.
And when somebody comes and, they come and say, I've been diagnosed with cancer, I want to get there's two pathways kind of they can follow. Either they just want to come periodically because they need a boost in their energy. Chemotherapy can wipe every patient out, and sometimes they just need a little bit of a boost. They need that replenishment of all the vitamins. They feel better, it helps them to detox. Some patients want to use it in conjunction with their chemotherapy, and they wanna be aggressive because whether they've done their research and they say, they've looked at research that said, you know what, my chemotherapy works a lot better if I'm getting vitamin C along with it. And I will tell you, in this area, you're gonna find oncologists that say, do not get anything IV, do not take supplements, do not, it's all gonna interfere with the chemotherapy. And I will tell you, it won't interfere with chemotherapy, that's well documented. And there are other cancer centers around the country that do support doing alternative treatments to help support the body. I mean, if you want me to get personal about it, I have an experience that we have gone to Cancer Treatment Centers of America, and their approach to cancer treatment is absolutely opposite than what you get here in this area. And that is where really I had the ability to sit down with top oncologists in the country who have been published in cancer journals to say, if you can get IV therapy, you do it, and you do it on this number of days after having chemotherapy, because I want you to wait and I want you to do it on this day. And they put you on supplements there, so some of the supplements, they're like, if you can get an IV, do an IV and do it on day number 5. And if you can do a pharma-infrared sauna, do it on that day. The vitamin C, you can have that anytime, during the treatment. They supported absolutely everything when it came to doing alternative treatments. But I find more and more in this area, you will have some that say, that's fine, you do what you're gonna do, it's gonna, make you feel better. If it helps, great. Some patients, they go for their checkup, their oncology checkup, and they say, whatever you're doing, keep doing it because you're doing really well. And then there are patients that their doctors have actually released them as patients because they wanted to, do something to help supplement and help build their body. That they just didn't believe in it, and they thought that it was going to, hurt their treatment plan. So I would say for years and years and years, I have seen cancer patients do this, and they really, really do feel better. Mm-hmm.
Thank you.
So we talked about kind of the oxidative effect of the vitamin C's and the way that, the role that plays, because we also do regular oxidative IVs, and that is using, again, an IV solution that has a pure pharmaceutical grade hydrogen peroxide that is part of the active ingredient. Now, hydrogen peroxide, it sounds kind of, and the first time I did it, I was like, oh, this is kind of weird. But, with hydrogen peroxide, you have food grade hydrogen peroxide, you have like a medical grade that you buy, in the brown bottle. And then there's pharmaceutical grade that's compounded by a, compounding pharmacy that can be administered IV. And basically, this is doing exactly what, happens when you get high dose vitamin C's. It's that hydrogen peroxide molecule that's going directly into the bloodstream. It reacts instantaneously. It doesn't stay as H2O2. It's going to break apart. It's going to create a water molecule, which is H2O, and that leaves one extra oxygen molecule, or atom. And that one extra atom of oxygen is what creates that free radical in that oxidative process. So with that, and I mentioned before too that hydrogen peroxide is actually part of your body's own immune system, and it helps the white blood cells produce something called peroxomes, which it's creating the hydrogen peroxide right in the cell that causes or inhibits the growth of bacteria, viruses, and yeast and those types of things. It destroys pathogens. And then of course your white blood cells go in, it engulfs them, and then it gets rid of it. So really the oxidative therapies are pretty simple. They basically are antimicrobial type IV. So when somebody comes in and they're suffering from a cold or flu or whatever, it's always the thing, well, do we do vitamin C or do we do hydrogen peroxide? Because they're gonna kind of create that same, antimicrobial effect. And again, it's just experience that is, well, I can just tell you that sinus congestion, they kind of do really well with vitamin C's. If it's a chest cold, they kind of do really well with the oxidative. And sometimes it's patient's response. Some people just feel really good with one over the other. So it kind of just depends, but that's kind of like our treatment for any sort of, upper respiratory, lower respiratory type, whatever condition. So chelation therapy. So chelation is kind of our detoxing type IV. So what is chelation? Chelation is it's a synthetic amino acid that is a negative free ion. So when it is in the bag and it's in a solution, it looks very much like a nutritional IV. In fact, it has vitamins and minerals, not trace minerals, but you get magnesium and there's sodium bicarb and some different things. It has vitamin C in it as well, which these vitamins and minerals are really supportive to the chelation process. But what happens is this negative free ion goes in, and the first thing it wants to do is just latch on to something. If you remember from chemistry class when you had to put all those molecules together, it goes in and it wants to latch on to something. In fact, the word chelation comes from the Greek word of, I think it's like key or something, because it wants to latch on to something. And so what is it latching on to? It's gonna latch on to any type of metal that is a positive type ion. So the first thing it wants to latch on to is calcium. It's the easiest, it's the quickest, and really this is where chelation therapy kind of got its beginning history for a treatment for heart disease. It started way back in kind of the 40s and 50s after World War II, men coming back that had lead poisoning from painting on the Navy ships and everything. They started giving them chelation therapy, and they started realizing that their angina was disappearing, they had better stamina, they weren't short of breath, their blood pressures were dropping, and it was kind of reversing any cardiac symptoms. So that's kind of really what led to the discovery, well, what is it doing? And for the longest time, and it's still part of the history and the use of chelation, is because one of the easiest first things it wants to latch on to is calcium. And it is pulling the calcium. It's easy enough to say that it just pulls it out of the plaquey areas and then it eliminates it. It's not quite that simple, and it really has to do with stimulating different hormones and the uptake of other calciums, and it kind of displaces calcium from one place to the other. One of the first things that you will hear is, oh, it's going to take the calcium out of your bones and you're going to get osteoporosis. And it actually has the opposite effect, because it's stimulating the hormones to uptake more calcium. So your end result is it actually helps to improve bone growth, because you're actually increasing the uptake of the calcium. But at the same time, you are displacing and removing they call it, I've heard it called metastatic calcium, or calcium appetite, that's kind of lodged into the atherosclerotic areas. And so aside from just the calcium, as they researched it more, and over the course of 30 years, they really started to discover that it is taking out other toxic heavy metals, where you're getting the reversal of not only heart disease, but other conditions, long-term chronic conditions such as diabetes, Lyme disease, Alzheimer's, MS, Parkinson's, different things like that, that there is an involvement of heavy metals that have autoimmune lymphoma. Because heavy metals, they don't stay in the bloodstream. If we tested anybody right now and I think I might have lead poisoning, or maybe mercury or something. If you tested a blood sample, never in 20 years have I had patients have a blood sample of lead, and they're expensive to do. And I can tell you, before that even comes back, you're not going to find it in the blood. You're not going to find it. It doesn't stay in the blood very long, unless there's a continual source of it. So when you see kids with lead poisoning, it's because they have a source. It's continual. It's either in the pipes or it's in the paint. That's why you're going to pick that up in the blood. If it is something, or if it's environmental, that somebody, maybe they work in a condition, that you're going to find it. Especially the welders and things like that, you're going to find it in the blood. Most of the time, over the course of the years and years of being in the environment, it's in food processing, it's pesticides, it's in water, it's sometimes in even medical tests, such as IV contrast. One of the biggest with that is gadolinium. And if you think of the half-life of different metals, if you're familiar with the half-life, is the amount of time that half of that will be removed and broken down and out of your body. Gadolinium has a half-life that is like decades long. So if you have had CAT scans, or somebody that goes for routine CAT scans for just follow-up care, you will have gadolinium in your body forever. And luckily though, chelation is one thing that can get gadolinium out. With chelation, it has, just like you kind of learned in chemistry a long time ago, there's certain valences and it has certain affinities for heavy metals. Chelation tends to want to bind to those lower level metals first. So you're talking your electrolytes, some of your trace minerals. You might lose some trace minerals along with chelation. The goal is to get to your higher level metals, the more toxic metals such as your lead and mercury. And you hear lead, you know that mercury is 500 times more toxic than lead. And when I talked about it not staying in the bloodstream, so where does it go? It tends to settle into muscular tissue, glandular tissue, and nervous tissue. So when you start to age and you've just kind of been on this earth for 45 years, 50 years, you wonder, why is your thyroid function diminishing? Why is your adrenal functioning start to diminish? Why do you start to develop dementia and those types of things? And it could be years and years of heavy metal exposure. Along with the heavy metals, they really discovered through just researching chelation that aside from pulling out the calcium, removing the heavy metals is what was really reversing heart disease. They're finding that through your oxidative process that's happening, when you have a high load or a heavy load of heavy metals, that oxidative process that should be a positive thing that's happening, it's oxidizing these heavy metals that are in your body and your bloodstream. And so everybody knows what happens to your car when it oxidizes. It starts to rust. Well, what happens when this normal process happens to these heavy metals? It's creating inflammation. It's creating, again, a more acidic environment. Even now with heart disease patients or with any patient, you're checking to see what their inflammatory markers are. And we're finding that our bodies are becoming more inflamed than ever. You're checking like C-reactive protein. So what's happening when your vessels are inflamed? The temperature, and this is actually a study that was done on patients that had fatal heart attacks. And they were testing these areas for inflammation, these areas of atherosclerotic plaque. And they realized that they're not from the narrowing of the arteries, because when you get narrowing of the arteries, you're getting symptoms, you're getting short of breath, you're getting angina. They go in, they put the stent in, they open that area up. What they're finding is really fatal heart attacks are happening from something called vulnerable plaque that's kind of hidden in the vessels. And what's happening with inflammation, so when you're having this oxidative process and these free radicals, they're going in, they're creating inflammation. So just like butter to a wound or whatever, your body starts to lay down something soothing, and kind of cholesterol is kind of the, they get the bad rap because you're finding that cholesterol is part of your plaque, and then you have things that's like the glue that holds it all together. Cholesterol is just kind of at the scene of the crime, basically. But what happens is your body continually goes through this free radical damage, and it's almost like sparks are happening on the inside of your arteries, and it causes inflammation. What happens is they start to maybe break open, and so what does your body do? It sends fibrin and other things there to seal up the patch, and it might hold for a while until it happens again, and it seals that patch up again. But as you're continually under stress, under just a poor lifestyle, poor environment, you're inflamed, you're fatigued, you don't feel good, eventually this bulge, this plaque that is really not in the narrowing of the arteries, it's actually building into the wall of the arteries, it lets go, and your body goes there and says, uh-oh, and it creates a giant clot formation, and usually that's the clot that will cause a massive heart attack then. And so what they're finding when they were doing the studies, that there is actually, they took the temperatures of these arteries, and they're actually finding that the temperature inside is higher, that it really is inflammation that is kind of the source of atherosclerosis. And so, I don't know, do you have any questions with that? That's a lot of physiology with it. And so I guess by doing the chelation, the whole thought with removing the heavy metals, you're reducing the heavy metals, you're reducing the free radicals and the oxidative stress that's happening. Aside from, you start talking about trans fats and your bad fats, and when you have oxidation of those, that is causing inflammation. I mean, we know that bad fats are just not good for you. It causes oxidative stress, and it takes a really good process that should be happening in your body, and it makes it bad, because when you start to oxidize those bad fats, it's gonna lead to heart disease.
Is
What
there
else
someone
can-
who you would say should not have chelation therapy?
I would say anybody that has a pre-existing kidney disease should not have chelation therapy. Chelation therapy is eliminated through the kidneys. I have never ever seen chelation therapy cause kidney problems. I have actually seen chelation improve somebody with kidney problems, but you have to do it very carefully. It requires blood work often, urine testing often, very low doses, but I've actually seen it improve kidney function. But that's why these types of treatments, it's not meant for people that just kind of, oh, we're just gonna give chelation a try or whatever, and they don't really know what they're doing. When you look at the history of chelation and you're like, oh, how's chelation? Did anybody, oh, there's one case, I think, that somebody died from having chelation therapy. And quite honestly, it happened down in Ohio, and it was nursing error. It was nursing error. So if you're seeing somebody that they're just kind of dabbling in it and they really don't know what they're doing, that's not the place that you want to go. I would say out of all of the things that we do here with the IV therapies, chelation therapy, and I've told this to nurses I have trained over the years, chelation is your biggest hazard. Don't ever mess up with chelation therapy. We do offer 2 different types of chelation therapy here. So there's lots of different chelating agents. Years ago when ACAM wrote the protocol on chelation, it was the old 3-hour IV. It was a very high dose of EDTA, and it took 3 hours to go in, and it was a little on the painful side. And they really found through studies that you can achieve the same outcome if you cut that dose in half. And then, so we started kind of back then going to like the 1.5 hour type treatment, which is a disodium EDTA. And then it was Gary Gordon who really put the studies out. And Gary Gordon, he was the founder of ACAM. If you've ever heard of ACAM, it's the American College of the Advancement of Medicine. And he was really the pioneer of chelation therapy in alternative medicine, and really establishing protocols and kind of standardizing this, because back then there were doctors that were just doing all kinds of stuff, and they really had to kind of standardize it and make sure everybody was doing things safely and using, let's say, a similar type protocol. And it was probably, 20 years ago he had started doing it. You're probably talking 30 years ago. He started doing some studies and work on chelation therapy and found that if you give EDTA that is already bound to calcium, because we said the first thing it wants to go to is calcium. If it's already given as a calcium EDTA, it skips that step of the chelating process. So the next thing it wants to go to is the next higher level and the next higher level. And what they found is because it's bound to calcium already, you can give a very high dose very quickly, and you are actually going to reach the higher levels of heavy metals, your lead and mercury, again, gadolinium, which is up there on the list. And actually, you know what? I'm going to show you these. I'm glad I thought of this, because a lot of times patients will ask, well, how do I know that it's helping or doing anything? And I can tell you it's absolutely doing something, because it's going in as a negative ion. It has to latch to something, and your body's going to get rid of it. So one way that we can test is to do a urine study. So what we would do is, after we give you several chelations, because sometimes it takes some time to mobilize these things. These things are embedded deep into the tissue. And a lot of times the first couple chelations, you're getting the lower level things. You're spilling out a lot of tin, maybe a lot of aluminum, and some lower levels. That's good to see, but you want to kind of see where you are with higher levels. So what we do after about the 3rd or 4th chelation, we're going to have you collect your urine. So we're going to give you a chelation. We call it a provocative urine collection, because we're provoking these metals out. And then what you can see is you collect your urine, and then we send it off. and you can actually see what is coming out. So you guys can pass this around and see, like for this particular person, they're putting out a lot of aluminum. You can look at the list that this particular lab tests, but you can look at mercury and you see how much mercury is being spilled out. So this is just one example. And patients, they can do this test. It comes out of their pocket. The test is $60. If they want to do it, I had a patient once that did it with every single treatment that he got. He wanted to see what was coming out with every single treatment. And that's his choice if that's what he wants to do. That's, most of the time, maybe about every 10 chelations or so, we'll check the urine to see what is coming out. This was a very interesting urine study, and it was the only one of its kind that I had ever had a patient do. He did it many, many years ago, and I've always kept a copy of it because I'd never seen another patient that actually paid to have this done. And what it did was he did a urine sample before chelation and then a urine sample immediately after chelation. So before EDTA, before having chelation, and I will let you guys look at these, he was putting out fractions of deciliters or fractions of micrograms or milligrams per deciliter of metals, like barely anything. Your body has a natural chelating process, so if you checked it, you're gonna spill it out just because of like the metabolites and the breakdown of things. The very interesting thing is to see how much it increased after having chelation, and you guys will just have to look at this. And then the third page gives an actual percentage of how much that increased. So for example, aluminum. After having chelation, his aluminum output went up 2,600%. Arsenic went up 100% after having chelation. Cadmium wasn't a great chelator. Things like cobalt. Lead is the kicker. After having chelation, his lead output went up 38,000.4% that you're going to put out. So even if you don't think you have lead, let me tell you, one of the biggest parts of bringing lead into your body, into your environment, is on your shoes. You're having things from the airplanes that are dropped down. Even cars, even trucks, even though you use unleaded, there's still lead in there. You walk around, one piece of advice that somebody said, don't ever wear your shoes in your house. Take them off at the door because that is the biggest source of lead that you get into your body. So if you guys want to look at these, I just always found them very interesting. Pretty much doing this for so many years. Oh, and then of course, what kind of treatments can chelation, because we talked about the heart disease, but heavy metals play such a role in chronic disease. And probably one of the biggest things that just a couple weeks ago that was put out is the effect of heavy metals on Lyme disease. And Lyme disease, I have seen more Lyme disease in the last 2 years than ever before. And what they're really finding is patients with Lyme disease, they're very high in heavy metals, and actually that these metals creating an acidic environment is creating the perfect environment for Lyme disease. And they are finding that offering chelation therapy for Lyme patients are really helping to expose the bacteria that causes it and helping the body to kind of attack it really and get it out and help the healing process. But otherwise, heavy metal, chronic fatigue, anybody that has high iron, which you don't think, normally you think you're low in iron, but a lot of times, especially men, a lot of times it could be their work environment. They are high in iron, and if you are high in iron or high in ferritin, which is your stored iron, you are going to have more viscous blood, you're going to have higher risk of heart disease, heart attack. And so iron is a tricky one. It takes quite a few chelations to help get the iron, but it's really for the benefit of reducing your risk of heart attack, stroke, that kind of thing. Chronic pain, it helps. Diabetes, because diabetics, one of the biggest risks to diabetics are the are damage to this very small vasculature of the eyes, of the kidneys, of the gastrointestinal system. You know, they start to develop malabsorption. And really what it does, neuropathy in their fingers and their toes. And what it does is helps to open up and remove those, remove those kind of plaquey areas. It helps to restore vasculation, I don't know if that's a word, circulation to those areas. And it helps to open those up and reverse those side effects from diabetes. Again, we talked about improves dementia, memory, Alzheimer's, MS, depression, GI disorders like Crohn's, irritable bowel, those types of things. We mentioned Lyme disease. And that's about it. We talked about doing the urine challenge. If you're curious about studies that have been done, there was a study that was done by the National Institute of Health that really was, positive in the effects that it did show that there was benefits to getting chelation therapy. And one said it definitely did no harm to patients, but really it was safe and it was effective. And I believe I have that in one of those handouts that kind of cites that it did help to reduce cardiovascular events by 26%. So there's a benefit. So do you guys have any questions with anything?
How often, if you're doing either the nutritional or chelation, do you recommend getting them done?
I think consistency is what is important. If you are dealing with a chronic degenerative disease, like you are having symptoms, you don't feel good, I would say minimally, like weekly, and that could last anywhere from 10 to 20 weeks. Definitely with the IVs, and this is true of any type of alternative type treatment, you have to give it a try. You are not gonna see a result in one treatment. You really have to give it 10 treatments and see. And sometimes, especially if it is heart disease or something, you might, the first thing you start to see is your blood pressure is stabilizing. Your stamina is coming back. You're not getting short of breath when you walk up the stairs or across the parking lot. Those are the first types of symptoms that you start to see. Probably around 10 treatments or so, I notice men will say, you know what, my fingers and my toes are getting warm again, or I'm getting better circulation to those areas. And most of the time, with chelation, it could take anywhere from 10 to 20 treatments. Really, you start to see difference though in the first few treatments. With nutritional IVs, again, if you are trying to overcome something, consistency is what is important. For the healthy person that just needs kind of that extra little boost, it might be periodic. It might be every few months or so you come in and you just get that boost of, vitamins and minerals, and it makes you feel good. If you're somewhere mid-range, it could be once a month. It could be every 3 weeks. If you are really trying to battle something that you're struggling with, I would say weekly for 10 to 20 treatments and see how you do. It's a commitment, and it's a commitment even if you're using it for, supportive with cancer treatments. It's kind of a commitment, and unless you're just looking for that little boost of energy, if you're looking at it as like an adjunctive treatment, it really takes weekly treatments to really kind of see the reversal of disease, and consistency. If it's something that you're trying to overcome and you're only maybe doing it once every 6 weeks or so, you're not gonna see the results. You're gonna feel good at that time, and it's gonna give you that benefit at the time, but unless you're making a lot of changes and you're doing it consistently, you're not gonna see those changes.
So once you get to the point where, you're feeling better and your levels are better, what's the process after that? Because I'm sure if you just stop doing it, that's
Exactly.
just gonna go
Maintenance
back to the way
is
it was.
definitely the thing, and they definitely did studies. If you can maintain some degree of maintenance, you are going to maintain that level of health that you've kind of achieved. One thing I could say over 20 years is patients always come back. And because here, patients always come back, and I always remember patients because I did maybe 25 chelations on them 15 years ago. And then what happens, they felt really good, they were doing really good, and then they stop, and then what happens, 5, 6, sometimes 10 years, in the future they come back and it's like starting all over again. So they found, and they did studies, and this again was put out by Gary Gordon, if patients did some degree of maintenance. Now some people will do one block of treatments maybe once a year. They might come in and get 5 or 10 treatments once a year, do it all at once, and then they'll come back the next year and do the same thing. They found if you space it out over the course of a year, you're gonna maintain how you're feeling. And that's true of, heart patients that were getting chelation, or even cancer patients. If they are in remission and they are feeling good, I always recommend, just keep doing them periodically. Even if it's if they're doing good, everything is stable, every 6 weeks, every 8 weeks, just come in and keep everything in check. Keep that healthy environment going. You've kind of achieved it, you wanna keep it going. So many times patients are like, oh, I hit my goal, and then they go back, and then it's just one step backwards after another. Okay. I don't know, anybody have any questions about kind of what we talked about? Any of the treatments, was it too much information, or?
No, it's amazing though that you could just say all that. Remember all that.